I think I want to say that there is need for more collaboration between scientists, researchers, and the journalists. You see, if you don't talk to the media, misinformation will keep on spreading. But the government has, I would say that the government has done a lot in this regard. Personally, I've been recruited into the NCDC, one of their projects, and I was in Kaduna State. I was like the Kaduna State narrator, and I worked with the rapid response team there. I was following them everywhere they go, documenting what they were doing. And I think why that is important is because that way we can be able to tell stories, powerful stories that can change people's perception, you know. Because when people read stories that, these people are responding to this thing and this is what they are going through, they will really believe that it is true. For example, I was in Ibadan for like a week and I was following one of the frontline responders there. And you know, she was like the first person who went to take the first sample of the person who came in with the coronavirus to Ibadan. And she told me that after she took the sample and it came out positive, she was shocked. Immediately, she realized that she couldn't even go back to her house. She just made phone calls and directed that her kids should be moved to her mother in Ilorin. So you can see, if somebody reads this, he knows that this is a serious situation. After some time, you know, she was chaos everywhere. Even her mom came down with COVID. 1 a.m. in the night, she was sleeping. She woke up. She had to drive to Ilorin, and she met her mom in a very critical condition. She helped, you know, and resuscitated her and everything. So that story, when you tell that story alone, people will see that, yes, this thing is real, and it affects people. So I was following her everywhere. But, you know, sometimes some scientists or some researchers, or journalists, oh, no, 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 please go away, go away, go away. You always go and say the wrong thing about me. But I mean, I was in the biorepository lab at the University College Hospital. I spent time there with them, just watching, hanging around, seeing how she interacts with people and everything that she's doing. And I documented that story. And I think, yeah, thank you so much.
Thank you. I would like. I'm sure you agree with me that he's needed here. Yeah, so I would like to call on Prof. Kolawole to shed some light on how to relay the evidence or information there from COVID-19 research to evidence users. Prof, please.
Okay, thank you. Thank you once again. I think fundamentally that's one missing gap again, which NYA, just as the last speaker said, need to take up. We have several information, particularly in this nation, in terms of research outputs, which are not properly relayed. And so when they are not properly relayed out to the people, the community, it tends not to bring forth any results as is expected. Now, when COVID-19 pandemic started, particularly in Wuhan, many countries were, bringing out what they refer to as the national early warning signs. Unfortunately for us as a nation, even as Africa, we never had a national early warning signs, which we refer to as news. So all we did was to copy and paste, copied what they said. Oh, look for fever. If you don't find fever, look for somebody who is having a runny nose. You know, it took us time for us to understand that every environment has its national early warning signs. These are critical issues which we have been left over the years. We have had several scientific reports in this nation that have been dusted and dumped somewhere, not used, not published, not brought out in a clear manner for the community to use, particularly in terms of government policy intervention. You recall that I had conducted a research which I published in 2017, where I reported for the first time in Nigeria, coronavirus OC43, which is a sister strain of the current SARS-CoV-2. That was the first report ever in this country. It was published in BMC research notes. I wrote a note to all healthcare professionals to expatiate the fact that us now reporting coronavirus, the first of its kind as a respiratory tract infection in individuals in this country, is a very, very serious alert for us to be, put up our response in terms of respiratory tract infections. Little did we know that in 2020, we'll be coming down with SARS-CoV-2. Now, the question is this: even when we had the SARS-CoV-2 coming into the country, people began to ask, what do we do? There's a missing gap between science, laboratory research, and then interpretation, bringing it out. That is what the journalists are expected to do. And this is one of the critical roles I also expect the Nigerian Young Academy to take up. We have several reports from scientists in this country that have not properly relayed out to the community. So one of them is what I've just mentioned now. So as a nation, we began to wait, what do we look for? Even when we said, oh, somebody has done something, like, oh, are you sure? We asked several questions. There were no database, national database that we could refer to say these are the national early alert warning system or alert warning symptoms for respiratory tract infections that are peculiar to our own environment. So we began to wait for copy or what is being done in China. Do we do it here? What are they doing in the US? So, this is one area which research today we need to begin to look into. I want to commend the federal government of Nigeria for taking the initiative to bring some of us on board. The committee which I belong to currently, the Ministerial Expert Advisory Committee, that have given scientific advisory roles, clean advisory roles to the Honorable Minister of Health, very also to the PSC, that's Presidential Steering Committee, chaired by Professor Oyewale Tomori, the renowned biologist. You see, it has helped us a lot as a nation because more often than not, we tend to review the policies, looked at what next do we do. It's not everything that is done in the US that has to be done here. Our peculiarity of our environment is different. So I think by the time we begin to promote scientific driven response in terms of policy formulation and implementation, I think we have a long, we are going to do ourselves a favor. And I want to appeal to the journalists that this is not the time to begin to report. Some of the things, some of our headlines are very terrible. I remember when COVID came, and I said I wrote a proposal to the federal government on vaccine development. And the headline was so heavy that I was called all over the world. They said I produced a vaccine for Nigeria. The journalists just took it and said Nigeria has produced a vaccine. How did you produce a vaccine when you just reported the first case of coronavirus in Nigeria in February? So we just got a vaccine. There's a lot of misconception from the journalism. So I think we need to bring in those who have good understanding of science research. Just as the last speaker said, train people. Not all journalists actually understand scientific languages and how they need to report them. And that's the reason why more often than not, the population, our populace, do not believe some of the things we say any longer. Because when we come to tell them that, oh, this is real, say, oh, we read this in newspaper, they just want to make money, they want to sell. And somebody who's reporting the wrong thing for the community, that's what they believe. So the need for us now, there's a synergy, there's a need for a synergy between the journalism, and the science community to come together. There's a need for training. These are areas that NYA also can promote. So I think this is a good time for us to move on as an academy and also move on as a nation. So on this note, I say thank you once again for the privilege.
Thank you, Prof. It's always good to have people like you, Prof. And always you see talking from experience, talking with facts. So we'll go this way. Is the segment for comment and question. We will take numbers. Then we will try to be gender sensitive this time around. Okay. So please, if you have comment or questions, raise up your hand so I can take numbers. Okay. So, Prof, you are 1, 2, 3, 4, 5, 6. Please, if you can make it like as much as brief, please.
Yeah,
thank you, sir.
I'm Idika Carlo Idika, Professor of Veterinary Parasitology. My comment is based on things that have been highlighted here. One is the need for surveillance, but more importantly is the need to scale up our testing. These really do not have much to do with education, because even in the United States of America, there are people saying COVID is fake. There are people, in fact, 2 or 3 days ago, some people protested against the vaccine. Okay, so you see, it cuts across. So, but here in Nigeria or Africa, the peculiarity of our case is somehow we have a level of herd immunity that somehow resists the virus. So that gives us a false sense of protection. We can all afford not to wear masks here. Go home, nobody will be sick. Okay? We go to the market to see how we mingle. Nobody falls sick. So it gives us a false sense of protection. But the problem comes in when something else crawling. Someone, maybe you get stressed up, your immunity falls, the virus strikes. Look at how cholera ravaged Nigeria in this time, 2021. Before, cholera was usually problem with children. Now even adults die of cholera. So this may be working together.
Yeah.
Probably the cholera could devastate now because COVID was there, waiting for an opportunity to strike.
Yeah.
So that's really what we should look into, okay? And important thing is to scale up the testing and let the people know that they are not being tested so that they will be sent to isolation center. They are being tested so that we will know the situation and be able to take action if need be. Then the government should also scale up their intervention in other disease control, because communicable diseases can lead to other things. So if you're targeting COVID alone, neglecting other diseases, they can join together and produce. At the end of the day, what we're trying to stop is mortality. You control it, you try to scale down morbidity and mortality in COVID, whereas the other ones are taking advantage of COVID to kill people more. So these are things we should look into. Thank you.
Thank you, Prof. I will agree with you that the main issue is that, yeah, you might think that you are young, you are energetic, you have immunity. Yeah, you may have and clear the virus. But the problem now, if you live here, you go home, grannies and elders are there. If anyone of them is hypertensive or diabetic and so on, the likely downstream effects of that. So number 2, please. Thank you.
My name is Said Adio from Mechanical Engineering OAU. Mine is of a question. Part of the mistrust within the country is because of the corruption that is ravaging this country and probably the continent of Africa rather. My question is there a way or is there something in place to actually confirm what is being reported by dissenters? Just like when he was talking the other time and when you also was responding, he said there's a network of laboratories. They do the test, they just put the data into the computer. It is what you give the computer or the software that the software reports. Is there a feedback or something to actually check, are these tests being carried out or they're just writing numbers? This is very important. Thank you.
Yeah, I can respond to that. Yeah, thank you very much. Yeah, that question will be responded to. I think I have also some response to that question. Number 3, please. Can you jot down, please?
Thank you for the opportunity. My name is Peter Chukwunonsokoli. I'm from Analytical Environmental Chemistry Unit of Department of Chemistry, Alice Ekwema University. Actually, most of my questions have been taken, but I want to see maybe look at the other side that has not been taken. Both speakers say that I don't want to use statistics, but many of us here, even from the way the last speaker spoke, still have doubt about COVID-19. And we are lecturers. 90% of the members here are lecturers. So how can we be spreading news about what we don't believe in? So that has been agitating my mind, you know. So, Professor Okola Wole, my big boss, said that we should be liaising with the media. That would be good. But if we are liaising with the media and we don't believe in the information we are giving the media, so I think NYA should have a role to play here. And I want, if it will be possible for them to, all of us to discuss the role so that they say that he that goes to equity must go on clean hands. So I want us to go on clean hands. Thank you.
Thank you very much. Number 4, please.
Thank you very much. I'm Anima Shaun.
Do you want to respond to that?
I'm Anima Shaun from Futa Akure. When we are talking about coronavirus, we're talking about something we cannot see. And when we are talking about something we cannot see, then we talk about force, which is mass times acceleration.
Yeah.
Now, when this acceleration is 0, we see that force will disappear. Now, looking at the whole thing, we can't see it. If you remember what happened at University of Abuja yesterday, we see that we hardly see students using this thing. So what does it mean? It means that we cannot see it, but we can only feel the force. For you to agree with me now, just go inside your car, sit down, don't use seatbelt. You will know that force exists. You will see your car ringing bang, 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 which means that there is a force. We can't see it, but it's very, very significant. So what is the solution? We are talking about policy. I will mention one thing, please permit me. You know, in mathematics, when we are solving a problem, we cannot solve it. Then we say we have reached our limit. Then we normally switch to something, which I would like to tell everybody here. There are 3 things happen when we want to solve a problem. Who designed the problem? How did he design it? For what purpose did you design the problem? Now, if you look at our Bible, all of us, we know Bible and Quran that we can use to solve almost all problems. Why? Because we know who, oh, Jesus Christ. We know, we know who wrote the Bible. We know how it was written. And we know why it was written. That is why all of us, we can use that Bible and Quran to do a wonderful things. And it will be established because we know who wrote it, why they wrote it, and how it was written. So we can use it. The same thing applicable to coronavirus. Who wrote it? Who designed it? Why did you design it? How did you design it? When we get to know to this thing, we will get the solution to this virus. It's very, very cheap. They only make us to believe that vaccine is the solution because vaccine is very expensive. And that is the one thing they can use to get the whole economy together. So vaccine is not the real solution to coronavirus, I can tell you. Anytime I'm praying about it and I'm doing a study, you know, we mathematics, our own is always the YDX. But that the YDX is everywhere, but we may not see it. So anytime we are dealing with something like that, I always get to that point when I discover that the solution is not vaccine. Who designed it? Why did you design it? How did you design it? Then we now see that the solution will be as simple x equals to 1. And what am I saying? That is when the acceleration is equal to 0. And when acceleration is equal to 0, there is no force again. We now say there is no force anywhere again. Thank you very much.
Thank you very much, please, sir. One house, please, sir. Hello? Hello? No, I want to check all the questions. We'll yank them out. Hello? Hello, please. One house, please. Dr. Mario, please go ahead.
All right. That was mathematical. So let me speak epidemiologically now. Emmanuel Osanya again.
Hello, please, one house, please.
I'm from Veterinary Public Health.
One house, please.
Preventive Medicine, University of Ibadan. So, can you repeat? Okay, I said we just had a mathematical perspective. So let me speak epidemiologically. I'm Emmanuel Osanya from Veterinary Public Health and Preventive Medicine, University of Ibadan. I'm going to wrap up my thoughts just with 4 C's. The first one is coordination. The second is communication. The third is consolidation of tests. And the last is committed fund to research. Now, just expatiate a little bit. I'm not going to take the time. The first one on coordination, earlier speaker have actually thought in that direction. And that is from the angle of multidisciplinary, One Health, participatory approach in addressing this issue. On communication, I want us to involve not just the media men, but media influencers, those who have influence on the media. We need to do some training with them. We need to involve both the digital and the print media, very, very important. So those that are effective at the community level. We also then on consolidation of tests. That has to do with area of surveillance and more tests. And that can actually, like Professor Kolawole made reference to, where we have some talk about why is the result relating. We have increase and decrease. At times then at the beginning, they had some problem with reagents. And so they had the time, the lab turnover. And then we have something we have like batch reporting and delay in reporting. And so if you can address that. And then lastly, of course, if there is no fund, no research. So you need to commit some research to that. Just to make an attempt, and those I might see, in addressing someone who talked about what can be done with respect to the distrust in the data. I want to say yes to verify the data coming from the lab. We have system put in place. We have data managers that are actually looking at what is being done. And the software, one of the discussants made reference to, it's not just a computer, it's just like, it's a surveillance platform. We call it SOMAS. And so that's what you use in reporting. So just to say that there are some system put in place to verify what is coming from the lab. Thank you very much.
Yeah, I think you are number 5, right?
Yes.
So number 6, the last one, please.
Thank you. My name is Akim Bawatunde. I'm from Department of Fishery and Aquaculture for University of Disneyland. I'm not a public health expert, even though I have some reasons to do some things with them on One Health. I want to say on 2 things. The first one is, like someone mentioned, if you are not convinced, you cannot convince anyone else. Now, within universities, someone is talking about students using nose masks. No, not students now. Even the academia, you have that issue. Just 2 weeks ago, I was saying I have to travel. I was like, should I go and take a vaccine so that I will have limited issue of taking swabs everywhere I go? And a very simple person said, go and write your, because once you take the vaccine, you have 2 years to die. So I don't know where that is coming from. Now, not all of us have our parents as professors. If in my house, I'm the only PhD holder, I become the reference point. So if I have to say that if I take vaccine, you will die 2 years, it means nobody in my family is taking the vaccine. So on actionable plan now, how do we start with those of us who are supposed to be in the known? Because we are major problems. When we are not convinced, you cannot convince those who are attached to us. That is one. The second one is issue of fluctuation, which is causing mistrust. Last year, I was privileged to be in one of the major labs that is very functioning for testing, to see a friend. And this is what is actually happening. If they have capacity to test 500 in a day now, they now get 200 samples. They can do that and run. But by the time they now have 250 patients that they are taking care of, they are still testing the patient while they are with them. So they will now, there's a way they do the division, that they must test the patient sample and still test those who are coming from outside newly now. Now, where I'm going is this. It means they are going to overpower their facility. Is it possible that they segregate and tell us, rather than now having 0 on Monday, then come to 1,100 on Tuesday, by Wednesday they have 0 again? Okay, this is what actually happened. We had this test on Monday, but we could not due to this. So this one is not actually for today. Perhaps people can flow with it. Rather than having that serious, you cannot put it on any map. It will not stay. So that may have a way of increasing the level of trust. Thank you.
Thank you very much. Before I allow the people on the high table to make their response to some question or comment, I was meant to know that Prof. Kolawole is still online. Prof, can you respond to some of the comments or questions, please? Prof Kolawole.
Yes, thank you very much.
Yes,
I think thank you. Can you hear me?
Yes,
Can
sir.
you hear me? So thank you very much. I think I'm happy. I'm happy that my distinguished friends, colleagues in the Nigerian Young Academy needs actually to be convinced. I kept hearing 1 + 1. I knew so many mathematicians are there. As usual, that's our usual trend in NY. But we need to be convinced first. Anyway, it's a wonderful family, and I know that by the time we are convinced, we'll go out there to do the job very well. Let me start with the last speaker who talked about several conspiracy theories. Of course, there are so many conspiracy theories, and we have come on air to debunk many of them. One, they said when you take the vaccine, it's magnetized and things like that. These are all lies. Globally, there are politics everywhere in life. But they are even in the homes, there are politics in the house. Between husband and wife, there is politics. Between children of the same parents, there are politics. I need to let us know that there are also global politics in terms of COVID, and that's the fact. As regards vaccination today, there are global politics in terms of vaccine inequalities, vaccine distribution, vaccine procurement. That's the truth about it all, and we must admit this. We are scholars, and we must know that there are also politics even among us all. But the fact is this still remains that what is true will always remain true. For example, my colleague there who talked about who created it. When somebody is dead, you won't ask him again. He can't ask you a question who created it. So what matters in life is to take precaution. But if you are dead, you can't ask that question again, sir. So who created it? Yes, you have right to ask who created it, but are you convinced that people are actually dying? That you've seen people are dead already and queried for COVID? If you agree that yes, people are dying of COVID, the extent of death might not be as that as we recorded in US. And I will tell you the reasons as we have here. We have had professors, renowned professors in virology that died of COVID. We have had professors that have died. And of course, these are all indications that we need that actually these are issues, not necessarily, if not even directly by SARS-CoV-2, but by comorbidities. Don't forget our immunity differs as individuals, and this is where I'm coming from. So for you to be convinced, oh, you are living well now, you cannot compare yourself with another individual. Everybody immune responses differs. And so I could be very much immunocompetent. My other colleague might be immunocompromised or immunosuppressed. And if I'm asked to use non-pharmaceutical interventions, and I said no because my friend is not using it, I don't understand his own state of immunity. So we must not say because somebody is not dying, and so I will not die. You don't will differs. And I need to say again that we are fortunate. I keep telling people that we are fortunate as the African race, particularly in Africa and Nigeria, that this respiratory tract infection we're talking about, I just told you that in 2017, I reported coronavirus OC 43 and then 29 and 229 NL 63 also. This, if you looked at the family of Coronaviridae, these are sister families to the SARS-CoV-2. The SARS-CoV-2 is a virulent strain, highly virulent than that of the coronavirus OC43. We have reported this in this country before. So in other words, it speaks a lot of volume that many of us as a people have built some level of immunity. And so we tend to survive if we also have strong immunocompetency. Now, but we advise is that how much of your immunocompetency can you be able to establish on your own? Because we don't have peculiarity of people really having tests done to establish the level of immunity which they have. So it's advised that you put your guards on. And what is the guard? The non-pharmaceutical interventions. And because we know that the non-pharmaceutical interventions, use of face masks and the social distances are difficult for our people, particularly Africans, particularly Nigerians. We must go out, we must mix, we must do parties, we must do several things. Then there's a need for us to enhance our immunity, even though we might have some impute immunity as a result of antibodies to the sister coronavirus strains which have been in circulation in this nation or in the Africa race for many years. We are used to flu infections a lot. And so we have built some level of immunity, antibodies in the body. But when you have a virulent strain like SARS-CoV-2 coming in, it will break down the immunity which you have established from a sister strain. And so it's possible that you come down with infection. And usually when you come down with infection and the immunity is broken down, it progresses to disease manifestation. And God helping you or not helping you, you have a comorbidity, maybe you have a debilitating infection like diabetes and hypertension and other agents, then it comes down to serious complications and severity of the infection, which could lead to death. So it is necessary for us to inform the populace that there's a need for you to take the vaccine. When you take the vaccine, what the vaccine does is that it tends to enhance what level of immunity you have in your body as a result of the sister strains which have been in circulation, which we have built immunity against. So it improves your immunity such that even with our carelessness, when you get exposed to high dose of SARS-CoV-2, which is the virulent strain, your body immunity is still able to subvert it such that you have an infection, but it does not progress to disease manifestation. And probably if such an individual has another comorbidity or co-infections, does not lead to death. So this is the essence why we're talking about vaccine is important for everyone, because you as an individual can only talk about yourself. Even yourself, you are talking about how much of immunity do you think you have. There's a current national sero survey going on in the country now. About the grace of God, I'm the PI for the country. This is being piloted by the Administrative Part Committee. It's a WHO-funded grant. And then results will soon be out, just to establish what is the level of immunity in our people in the country. Are we together? Am I still on?
Yes, sir.
Hello?
Yeah, yes, sir.
Okay.
We are with you.
So now we've been able to establish that our population will have some inbuilt immunity. And so what we are trying to do as a nation is to increase the number of people that will take the vaccine, such that we will not be able to vaccinate 70% of the population to establish the herd immunity we are looking for. But if we're able to establish that we have within our community, our population, also have antibodies against SARS-CoV-2, then the number of people that are vaccinated will be protective to the number which we want to extrapolate to achieve an herd immunity. So in the likes of this, there's a need for everyone to still be cautious, to use the face masks, because your level of your own immunity, you can't establish it if it's good enough to stand against a virulent strain of SARS-CoV-2, particularly the Delta variant, which is now in circulation, which is more virulent than the Alpha variant. And so if you have high exposure to the Delta variant and the level of immunity you have in your system as a result of the sister strain in circulation over the years before, or peradventure as a result of the vaccine you have collected, which has enhanced your antibody titer within your system, now it is essential that you still use your face masks, you still exhibit some social distancing, because it's a matter of saying, if you get exposed to high dose of the variants, there will be breakdown in the immunity which you have in the body. And then it could lead to infection. And that's why it is possible to have breakthrough infections, even when an individual is vaccinated. But it's very rare situations. Because when you are vaccinated, your immune system is enhanced. And as you comply with your non-pharmaceutical interventions, you stay safe completely. Even when you are exposed to infection, it does not break down your immune status and then leads to infection and progress to disease manifestation. So this is the principle behind it. As the question asks that, who created SARS-CoV-2? I'm sure our mathematician, I know where the direction is going from. SARS-CoV-2 is a virus, it's a viral infection, is a virus actually. And it belongs to the family of Coronaviridae. And there are sister families in that family. We have the alpha families, we have the beta families. So it's not new. It's as a result of, certainly could be as a result of mutation of the existing viral family, which is the same family. So, and mutation is a usual thing with viruses. All viruses mutate, and the rate of mutation differs as a result of environmental factors. So, and you agree with me that things are changing all over the world today globally. Our activities today has brought about a lot of mutations of most of these infectious agents. And so they can come up in different formats as a result of changes in their glycoproteins. So, and that's the sense why we say they are actually existing. If you agree with me that malaria exists, then SARS-CoV-2 exists. If you agree with me that, adenovirus that causes respiratory tract infection exists, then SARS-CoV-2 also exists. So who created it is not the issue now. The issue is that this virus exists and you need to exhibit the following, the non-pharmaceutical interventions, which is the best method. And then because we know people are not always compliant, they do not follow the instructions, we now felt that it is necessary to take vaccine such that if you are careless with the MPI, your vaccine you have taken will improve your immunity, the imbued immunity you have as a result of the sister strains that have been in circulation in the past from the same family, which you have built. But that sister strains antibody which you have might not be able to survive or might not be able to prevent SARS-CoV-2, which is a more virulent strain, from infecting you. With the vaccine, you have higher dose of your antibody titer against the SARS-CoV-2, which you are trying to prevent. Now, so that's just the principle behind it. And then the issue of NCDC, the scoring and the whatever, they are not just giving figures. There's a SOMAS. The SOMAS is the platform which is used in reporting for a nation. And there are many mechanisms in which this is double-checked. As I speak to you, these figures, when they come out, we also, as the Ministerial Expert Advisory Committee, we also look at these figures. We looked at it, and we also say people are looking into these figures.
Yeah, Prof, if you can summarize, please, Prof.
The only thing I think as a nation we need to do.
Hello, Prof, if you can summarize, please, because of time.
So as a nation, what we need to do is to scale up our testing. Okay, thank you. We need to scale up our testing. We need to scale up our sequencing capacity so that we can know out of these cases of SARS-CoV-2 virus we have, how many of them are actually Delta variants. These are the areas that are missing gaps for now. So, and as the Professor Indika said, this with the scaling up, we'll have more of us be able to establish where we will have problems in terms of the transmission of the Delta variants within the community, particularly in the states. I think I would like to end to say that NYA must believe first before you go out to convince anybody. So, and as scholars, we must believe that whatever we have come out with from these are facts. People who are in this area of specialty have informed us, and we need to respect people's view and people's specialty. I'm not a mathematician, but if mathematician tells me that 1 + 1 is 2, I will actually agree because I believe in what they have said. So as a virologist, I'm telling you that this virus actually exists. People are dying. Your friends are dying. Our neighbors are dying. Go out of Nigeria, you see the rate at which people are really dying. With the new variants now, we have even cases of now, not just variant of concern, we now have variants of high consequences again. So everyday things are changing. So on this note, I want to say thank you again for the invitation. I wish us all the best. Over.
Thank you, Prof. Yeah, so indirectly, Prof has captured some of the, the question that, hello, please. Some of the questions that may come off. So I would like to go to the ones that has not been touched, which are the last 2 questions. So I'll ask you this question, please. And please, you are free to also contribute because it's a question that cut across our area of endeavors. The question goes this way. Are there a need for academic and research institutions to integrate the general principle of COVID-19 response plus emerging pandemics in their curriculum or day-to-day activities? If yes, why? If no, why, please? Thank you.
Okay, thank you, the Vice President, and many thanks to my professor, Professor Kolawole, if he's still online. Prof is a great scholar, and we've been learning from him. Quickly, I would like to respond to that question from what transpired in the last couple of minutes. In fact, it was a very heart, broken issue for me when the great mathematician was asking that, who created, who designed, until we know, all that before we can know what to do. And people saying, somebody even said that, he was told that if he takes the vaccine, that he will die in the next 2 years or something. Yes, quickly, a quick one. Let me just say that to take the vaccine and die in the next 2 years, if that exists, in quotes, is even far better than you contracting the virus now and dying now. I stand to be corrected. So then, apart from that, the series of questions being asked by the mathematician. Because as members of the great academy, if we are not convinced that the first SARS-CoV-2, the first corona, the avian infectious bronchitis virus, was first isolated far back in 1937 by Fred Baudet. You can Google, you will see it yourself. He isolated the first avian infectious bronchitis virus, which is a member of the coronavirus that we are talking about. I was glad when Prof mentioned the study he did, in the country, the OC, the NL, subtypes that they were able to detect. That is to let us know that it is not that somebody is sitting somewhere and telling us the fallacy. No. But rather, the viral entities, they exist. We isolate, we see them, we work with them in the laboratory. So, members of the great NYA, I must tell you, these things exist. In fact, even some of us are being infected, like Prof said. Our renowned teacher, I wouldn't want to mention name because he never mentioned name, died of the same viral entity. A lot of colleagues, clinicians, virologists, they've been dying all over the world. So it is not an affair for fun that somebody will not stand amidst great intellectuals to still be doubting. We must be convinced as members of NYA because we are the scholars that will go out there to convince other individuals. And if we are not convinced now, I'm afraid there is a problem at hand. And we need to start, thinking the other way around. So where do we go? Talking about how to integrate NYA and the rest. I'm thinking if the president is around, he should get these points. I need to say this to us. I'm thinking there is need for NYA members to be sensitized. I volunteer myself, and I'm sure my prof will be willing to also do that. We need to do a webinar. We need to take 1 hour, 2 hours to tell us the genesis and show us figure, data on what we have been doing for you to know. We will even show you some of our activities in the laboratory for you to know that this thing is actually existing. Dr. Detoku is here. We published a paper together. It's in PubMed, where we worked on zoonosis and reverse zoonosis of SARS-CoV-2. We found data of animals harboring the viral entity, the animals transmitting it to human. We also found data from human infecting the animal in what we call reverse zoonosis. It's there online. You can go on Odetoku or Google my name, you see it. That is to tell us that this thing exists. So we need to sensitize ourselves. That's one. Then two, the role of NYA, what to do. I'm also thinking and factoring into our curriculum. I feel there's need to what my brother said earlier on. The journalists. If NYA is willing, I'm also willing. Can we go to the NCDC? Can we start discussing with the WHO Africa, CDC Africa, the American or the British Embassy in Nigeria, that we want to train journalists and editors on SARS-CoV-2, COVID-1 now, NYA now. It should be part of our assignment. It should be a project for us based on the request by our journalists here. Can we slate interval for that? Can we start thinking in that direction? First, training for our members, a webinar. Second, a week, 3 days, 2 days, or what have you, training for journalists and editors across the country, mainstream. In fact, I was surprised 2 days ago when I arrived and I was looking around. Oh, do we have journalists coming here to capture